So what we have here is a case that we're transitioning from a 1925 stainless steel upper and lower to the 018 finishing wire, and we're going to do some wire bends using the Intra-Oral finishing pliers. You'll notice that there's some space just distal to the upper twos because they were peg laterals. So I consolidated the space mesially, and then later I'm going to restore with full porcelain crowns or veneers these lateral incisors so that they'll look proper. But right now what we're going to do is we're just going to start intra-oral finishing bends, and I'm going to use the intra-oral finishing pliers. So what we did is we started a list of some of the things that we needed, and when she bites together, go ahead and bite together for me. When she bites together, I noticed that the bicuspids on this right side, both the upper and lower first and second bicuspids, are open just a little bit. So I'm going to take the 1/2 millimeter intra-oral finishing plier, and I'm going to make a couple of intra-oral finishing bends. So I know that I want to make a 1/2 millimeter bend up on these lower bicuspids on the lower right hand side. So I take the intra-oral finishing plier and make sure that the midline of the wire is right in the middle of the patient's lower incisors, and literally you go right to the wire and you just give it one squeeze, and what that will do is it will put a 1/2 millimeter up bend just distal to the 5 and mesial to the 6. Then what you do is you literally take this plier and just turn it over like this, and then go right to the mesial spot, and same thing. Put the plier on the wire, go in so that it's not right at the tip of the wire, and again make sure that it's stabilized, and again you can just make one up bend, and now it will take those two bicuspids on the lower and move them up 1/2 millimeter. Now I've identified on this lower left side that I want the lower left second bicuspid to come up 1/4 millimeter, and I want the lower left first bicuspid to come up 1/2 millimeter. So what I'm going to do is I'm going to take the 1/4 millimeter intra-oral finishing plier, and I'm going to go just between the lower 5 and the lower 6, and I'm going to give it one squeeze up, which gave the lower left 5 a 1/4 millimeter up bend. Then I'm going to go just mesial to the 5, and I'm going to go up again. And then I'm going to go anterior to the 4, go anterior to the 4 and give it 1/2 up. And so essentially what we did is we are bringing up the lower left 5 1/4 millimeter and the lower left 4 1/2 millimeter. So I had two up bends with a 1/4 millimeter plier and one up bend with a 1/2 millimeter plier to do that job. Now, as far as the upper arch is concerned, I've identified that I want the upper right 4 and 5 to be bent down 1/2 millimeter. Can you stabilize the wire for me? Use your finger. Just ready to go so she can see, and a little bit more towards the tube. So I'm just bringing the intra-oral finishing plier once again, just distal to the 5, about halfway between the 5 and the 6, making sure that the wire is basically where I want it, giving it one squeeze, and then again coming around and just turning it over and giving it one more squeeze just mesial to the 4. Okay, and then lastly we've identified one lower incisor as being to the buckle a little bit too far, so I'm going to make a 1/4 millimeter in bend on that lower incisor. Now you notice I moved the wire out of the slot just a little bit. The 1/4 millimeter plier actually is a little bit too big to get in between lower incisor brackets. So I'm going to just put it right between the two brackets and squeeze. And then once again, turn it over and go right to the other side. And squeeze again. And now what I have is a 1/4 millimeter in bend on that lower incisor. Now what you have to do here is tie in the teeth on either side of it to get the maximum activation of this 1/4 millimeter bend. Now you notice that there is a 1/4 millimeter bend on the lower right one, and the wire now is not passive in the slot on either the lower right 2 or the lower left 1. It's actually out of the slot just a little bit, and of course by tying these two teeth on either side of the lower right 1 in, it will actually push in the lower right 1, and the next time she comes in, all her lower incisors will be aligned. So what you have to do is tie in the two teeth on either side of the tooth. And again, as always, stabilize the bracket in the tooth. And now the wire is active and is actually pushing this lower left 1 back into the arch form like we want it by 1/4 millimeter. So the next time she comes in, as a matter of fact, since the teeth are mobile, since the wire's been in and we've been moving the teeth around, if I could show you an occlusal view of this tooth right now, it's actually in alignment because of the mobility of the tooth. So I can almost tell immediately that it's going to work just fine. The bend we made in the lower anterior, since it would have been pulling the wire out of the slot, needs to be tied in. The bends that we made, the up bends that we made on the lower right and the upper right, since they're going to be moving the teeth down and up and not pulling the wire out of the bracket slot, these actually do not need to be tied in, but generally speaking, we will tie them in during case finishing just for stability.